to your feet?
I listened to The Forces of Evil there, Raymond. I thought that was nice. I think we were shocked because the NHS has been abolished. We've got a sophisticated democracy here, and yet a government, without a by your leave, without any advance notice, as Jackie has already said, actually abolished the NHS because it took away, with an Act of Parliament, the fundamental duty of government, through the Secretary of State, to provide a comprehensive universal service.
They've replaced it with another word, haven't they?
They've actually replaced it with a whole sequence of words which do not amount to the same thing as a duty to provide a comprehensive universal service. And that meant that they could abolish PCTs. PCTs, which they described as red tape, were actually the public administrations that had the delegated duty of ensuring that everybody in an area received all the health services that they required. Now, nobody is responsible, but it's worse than that, because the act of abolishing the duty gave the Secretary of State, or now the agencies responsible for our health services, the freedom to cut down on the services that are provided. So fewer health services are now mandatory, and more health services can be charged for.
David, could you give some examples of things that are no longer mandatory, which people may think are mandatory?
Well, in terms of ordinary services, so for services for addressing ill health, which you might regard as a fundamental requirement of a health service, the availability of those services can now be determined by clinical commissioning groups without reference to the Secretary of State. So there's a new flexibility that is introduced into the system. A range of public health services, such as for sexual diseases, for child medical services at school, are no longer mandatory on local authorities to provide. So a range of services that we used to expect, are no longer there. Now, I'm late this evening, I apologise for that, because we've just been finalising a report on South East London, where Lewisham Hospital, as you may know, is being downgraded. And services in the South London Healthcare Trust are being cut. The acute beds have been cut by 17%, the staff have been cut by more than 20% to resolve financial problems created by a hugely expensive private finance initiative bill in the area. The Trust Special Administrator that's been brought in to manage this recovery, financially driven recovery package, identical to the driver in Mid-Staffordshire, which is a financial driver there to get, in that case, Foundation Trust status. The Trust Administrator has been able to introduce his new proposals for cutting back services precisely because there is no longer the requirement to provide a comprehensive universal service. And as a result, we have a budding public health crisis in the southeast of London, and of course more widely where A&E units are being closed without a proper, what we call a planning base, without a base that says this is in the interests of patients and the population in that area. There is no data presented to justify this decision. And the decision, as I say, is facilitated by the weakening or the removal of the statutory duties that we used to impose on government. It's a horrendous situation.
Thank you. And you may say, well, we live in a democracy, and we had a minority Tory government that formed a coalition. What happened to the opposition? Surely, I mean, this was in nobody's electoral manifesto to abolish the NHS. So who would like to comment on the absence of political opposition?